Thank you so much, and good morning, everyone. I'm so glad to get an opportunity to speak with you, the PQC this morning. We are so appreciative of the PQC member hospitals, health systems, community-based partners who are working to advance the maternal health in Pennsylvania. I'd like to express my sincerest gratitude to each of the healthcare providers, hospital staff, administrators, health systems, and everyone working to keep Pennsylvania safe and healthy, especially through the COVID-19 pandemic. The work that you do is critical, and you've had many successes, and you've made a great impact on the lives and health of pregnant people and their families within the Commonwealth. However, as we all know, there's still more work to do. The maternal mortality has steadily been increasing in the United States. In Pennsylvania, there's been an increasing trend in pregnancy-associated deaths in recent years. And the data on maternal mortality and morbidity demonstrates significant racial disparities in maternal health outcomes in Pennsylvania, but also across the country. Pregnancy-associated mortality ratios, as you know, estimate the number of pregnancy-associated deaths for every 100,000 live births. This measure allows us to understand how maternal mortality affects different populations within Pennsylvania. In Pennsylvania, the overall associated mortality ratio in 2018 was 82 maternal deaths per 100,000 live births. However, the pregnancy-associated mortality ratio for the non-Hispanic Black population was 163 maternal deaths per 100,000 live births, and the highest pregnancy-associated ratio of any race or ethnicity. And this ratio is twice as high as that for non-Hispanic white population. The disparate outcomes that we see in maternal mortality stem from the detrimental impacts of systemic racism, implicit bias, and social determinants of health. Through the work of the Pennsylvania Maternal Mortality Committee, or MMRC, and our Bureau of Family Health, the department seeks to reduce maternal mortality and morbidity across the Commonwealth, with particular attention to addressing racial disparities and the systems that contribute to disparate outcomes in maternal health. To better understand maternal mortality and the ways to prevent maternal deaths, Pennsylvania established the MMRC to review all pregnancy-associated deaths in the Commonwealth. MMRCs are multidisciplinary committees that convene at the state or local level to comprehensively review deaths of individuals during or within a year of pregnancy. In Pennsylvania, the Maternal Mortality Review Act, or Act 24, was signed into law in 2018, and it established the Pennsylvania MMRC. It was created for the purpose of confidential identification, review, and dissemination of findings regarding maternal deaths in the Commonwealth. It seeks to eliminate preventable maternal deaths and racial disparities and to reduce the maternal morbidities in Pennsylvania. And to do so, the committee systematically reviews all maternal deaths, identifies the root causes of them, and develops strategies to reduce preventable mortality, morbidity, and racial disparities related to pregnancy in Pennsylvania. Since the passage of Act 24 in 2018, the department has worked to establish and administer the PA MMRC. In 2018, the department appointed members to participate in the multidisciplinary team. They are experts responsible for reviewing cases and maternal deaths and developing recommendations to prevent future deaths. The PA MMRC includes both clinical and non-clinical members who represent diverse fields that pertain to the prevention of maternal deaths, including maternal fetal medicine, obstetrics and gynecology, midwifery, addiction medicine, emergency medicine, community health, psychiatry, social work, and violence prevention. Committee members also represent a geographically diverse set of individuals. For the first year of case review, the PA-MMRC reviewed maternal deaths of Pennsylvanian residents occurring in 2018. The community reviewed de-identified summaries of pregnancy-associated deaths in the Commonwealth, regardless of the cause of death, and included drug-related deaths, homicides, and suicides. Through comprehensive case review, the committee reviewed cases of maternal deaths, determined whether or not these deaths were pregnancy-related, determined preventability, and developed recommendations to prevent future maternal deaths. A report outlining the 2018 case review and recommendations has been developed by the PA-MMRC and will be available by the end of this year. Once this is published, the MMRC report will be available on the department's website. Moving forward, the PA-MMRC and the department will continue to work closely with the PQC to implement these programs and services and develop policies to address recommendations from the committee. The department continues to improve processes to ensure successful and comprehensive maternal mortality case review. And the department's MMRC program staff are focused on developing relationships and establishing a clearer and more concise case review process for future years. We know that many factors influence the health and the well-being of pregnant and postpartum individuals. Pregnant and postpartum individuals are dealing with mental health issues such as depression and anxiety and substance use disorders, as well as facing stress and safety concerns due to intimate partner violence. I'm so encouraged by the work that the PQC is already doing in these areas. We must continue to identify and address the pregnant and postpartum individuals. Your work with the PQC is already helping to address those needs, and I'm grateful for each organization's participation in this very important work. You are truly saving lives. I would like to extend my sincere gratitude to all the members of the PA-MMRC for their commitment and determination to prevent maternal deaths in Pennsylvania. I'd also like to thank our outstanding department staff for their support of the PA-MMRC. The staff has worked ceaselessly over the past few years to stand up the MMRC within the department, and they continue to work to improve the program. The commitment of the PA-MMRC to understanding maternal deaths and providing recommendations is fundamental to improving maternal health outcomes, saving lives, and improving the health of our community. Thank you all for the partnership and the work that you continue to do. You are truly making Pennsylvania a safer, healthier places for our families. Thank you so much.
Excellent. Good morning, folks. So I can't echo enough all that Dr. Johnson just outlined for this group. I do want to note at the top that I will be departing the Department of Health at the year's end, and today's gathering was one of the primary pieces that I really wanted to participate in prior to exiting, because I wanted to thank you all. You all have been steadfast through a lot of tumultuous times, primarily driven by COVID-19. But what you have done and achieved nonetheless has truly allowed us to be in a better place as we sort through all of the post-pandemic world that we're going to be facing. It's a little bittersweet to be gathering with you all today, because I think departing at any time, there's always a sense of, oh shoot, what more could we have done? How much more could we have achieved if we just had a little bit more time or a little bit more of an opportunity here? But that's one of the greatest parts about this group as well, is that there's a lot of opportunity to keep improving. And if it continues with the inertia that this group has already demonstrated, I have no doubt that it is going to be profound in its impact in Pennsylvania. And so it really is a great honor to be here, especially with other cabinet secretaries and Dr. Johnson. I can't tell you how much there's just a really core leadership team within our Health and Human Services Hub that's going to be dedicated to continuing this mission. And so with that, just wanted to first start with gratitude, first to the Jewish Healthcare Foundation and Robert and others for the opportunity to address you all today, especially the hospitals, the health systems, the community partners that have been here through it all. As you guys know, the COVID-19 pandemic took a lot of our resources and our focus, and unfortunately hampered some of the most meaningful initiatives that were previously underway. But throughout this pandemic, hospitals, healthcare providers continued to provide quality care to pregnant and postpartum patients and infants in Pennsylvania. And for that, we are eternally grateful. And so thank you to all of the healthcare providers, the hospital support staff, administrators, health systems for your tremendous efforts to keep us on track and healthy while providing quality care to your patients. Unfortunately, as it's been noted thus far today, maternal mortality and morbidity continue to affect the families and the communities of Pennsylvania. Maternal mortality is devastating for families and communities in Pennsylvania and throughout the country. But unfortunately, maternal mortality is just the tip of the iceberg. For every pregnant and postpartum person who dies, there are more who barely survive. And that is one of the primary reasons that the Wolf administration has made maternal and child health a priority for Pennsylvania as well. Throughout this administration, addressing maternal mortality and morbidity has been and continues to be a priority for the Department of Health as well. One way that the department has sought to address maternal mortality and morbidity is through participation in the Alliance for Innovation and Maternal Health, or AIM, which has been discussed already today. Over the last year, the department has been collaborating with PQC to implement the AIM patient safety bundles across Pennsylvania's hospitals. On October 1 of 2020, Pennsylvania became the 38th state to join the Alliance. AIM is nationally data-driven and maternal safe improvement initiative funded by the Health Resources and Service Administration and operated by the American College of Obstetricians and Gynecologists, or ACOG. Participation in AIM provides states the opportunity to implement AIM's patient safety bundles and track success on improving maternal outcomes through a national data center. Through Pennsylvania's AIM initiative, the PAPQC is working with hospitals to implement AIM's severe hypertension in pregnancy bundle with the racial and ethnic disparities bundle. The selection of the AIM severe hypertension bundle was informed by analyses of hospital discharge data from the Pennsylvania Healthcare Cost Containment Council, or PHC4. The analysis showed greater racial disparities for preeclampsia and eclampsia than for hemorrhage, and a greater increase in preeclampsia and eclampsia rates among Black pregnant patients between 2015 and 2019 compared to the increases in hemorrhage rates. Integrating the severe hypertension and racial and ethnic disparities bundles allows Pennsylvania to improve outcomes related to hypertension with a specific focus on the populations bearing a larger burden of maternal mortality and morbidity. And through this initiative, Pennsylvania seeks to reduce the rate of severe maternal morbidity among those with preeclampsia and eclampsia and reduce the racial and ethnic disparities that exist in severe maternal morbidity. Additionally, the PAPQC and the department aim to increase the proportion of pregnant and postpartum individuals with severe hypertension who are treated within 60 minutes across races and ethnicities. Throughout 2020, the PQC has worked with the department to implement the AIM initiative by onboarding hospitals, building out the integrated patient safety bundle, and analyzing hospital discharge data to track AIM outcome measures. To date, 19 Pennsylvania hospitals are participating in AIM by implementing the patient safety bundles and tracking maternal health outcomes. The hospitals have been working internally to build out their AIM quality improvement teams and to develop protocols and quality improvement plans. Through this initiative, the participating hospitals are implementing quality improvement projects and processes to ensure quality treatment of hypertension and related conditions among all pregnant patients. The work to implement the severe hypertension and the racial and ethnic disparities patient safety bundles has a direct impact on patient care and seeks to reduce severe maternal morbidity and save lives. I would like to extend my gratitude to the PQC and the participating AIM hospitals for their work to reduce maternal mortality and morbidity related to hypertension and to address racial disparities in maternal health outcomes. The AIM initiative, like other projects implemented by the PQC, is paramount to improving care for pregnant and postpartum patients in our communities. The department is grateful for the partnership with PQC and several other entities and the opportunity to present today. We are also committed that through the transition of leadership, this will remain a priority for the department.
So good morning, my name is Meg Sneed and I am the Acting Secretary for the Pennsylvania Department of Human Services. Thank you so much for allowing me to join you all today. And most importantly, thank you for all that you do every day to support birthing parents and children around Pennsylvania. Our work to support families, especially birthing parents and children in their earliest years, is incredibly close to my heart and something that I feel very grateful to have the opportunity to work on through my role here at DHS. Since returning to DHS, I've had the opportunity to visit with some of the birthing hospitals that participate in the Moving on Maternal Depression program, something that I'll be continuing after the holidays and the new year. These visits have allowed me to see and hear firsthand the impact of this work on birthing parents and how this support is making a difference in their lives and helping health systems rethink their approach to perinatal care. I visited UPMC Magee Women's Hospital last month, where part of the focus of their MOMD work has been to expand use of doula services as part of birthing parents' perinatal care. This is part of the hospital's work to advance equity for people under their care and to embed cultural competency as a focus of care, prioritizing hiring doulas that are representative of the communities they serve to help build trust with pregnant and new parents and hopefully foster better engagement on perinatal and related care. From what we can see through the preliminary data, the MOMD effort is producing tangible results really quickly. By better identifying perinatal behavioral health needs, we can get birthing parents the support and care they need and deserve, and embed a focus in understanding data by race will give us the data we need to be sure we're working to correct disparities. That success is only possible because of your work, and I look forward to seeing what will come in the next year as the effort matures and hopefully expands. We at DHS are committed to improving the extent and quality of care for Pennsylvania families, especially our most vulnerable, through a delicate and crucial period of their lives. So if there's anything we can do to support or uplift your efforts, we want to continue to be active partners in this work. Our shared work to embed better perinatal depression screening, follow-up, and treatment practices are an important step to making this practice a foundational part of prenatal and postpartum care, and I'm very grateful for the PQC's leadership and partnership in making this work a reality. DHS announced over the summer that we intend to extend postpartum coverage to a full year for birthing parents who qualify for Medicaid or CHIP coverage because of their pregnancy as soon as the option becomes available in April of 2022. I'm very grateful that states have this option because of the American Rescue Plan Act, and I think it will be an important resource to support birthing parents who may have historically fallen through the cracks due to making too much to qualify for Medicaid, but still might not receive employer coverage or be able to afford a quality plan from the marketplace. This extension will help birthing parents continue to access the care they need after giving birth, care that often extends beyond the 60 days that Medicaid currently covers for postpartum. Access is a critically important step, but it's a first step. Care must be responsive to a patient's needs, and we have to support patients with follow-through when necessary so that care and support can make a difference. As we seek to reduce our maternal mortality rate, we need to make whole person care and the focus on follow-through and treatment when needed a core part of perinatal care. Birthing parents, babies, and all parents raising children deserve more, and I know that we can make progress here. This group has demonstrated that, and I'm incredibly grateful to have you all as partners. Thank you again for allowing me to join you all today and for your work every day. I'm excited to see the good I know you'll continue to do.
For those of you who are agenda followers like myself, I'm sure you're recognizing that we're a little bit past. So I'm gonna just try to be a little more brief in my remarks. I'm gonna cut out the huge amount of thank you that I had included in the beginning, because I think that Dr. Johnson and Acting Secretaries Beam and Sneed really kind of covered that. Thank you for what you do. We're so appreciative. I think a lot of you are aware of the Department of Drug and Alcohol's mission, which is really to improve the lives of people impacted by substance use disorder. And some of what we do has to focus on providing supports for the most vulnerable populations. And in this case, that would be pregnant and postpartum women. And of course, our tiniest Pennsylvanians, our newborns. So just a couple of quick statistics. The CDC is reporting that the number of women with opioid-related diagnoses at delivery has increased 131% from 2010 to 2017. That's huge. In addition to that, the number of babies born with neonatal abstinence syndrome increased 82% during that same period of time. And that increase was seen across all states and all demographic groups. So the work that you're doing is so critically important. And we recognize, as Secretary Beam mentioned, COVID has not been our friend in a lot of ways, and particularly for those impacted by substance use disorder. It really has reconfirmed our need to address addiction and addictive behaviors and to support individuals that suffer with that medical disease. And I joined a little bit before our panel, and I heard the speaker before us talking about how important it was to message to the women that it's a medical disease. And I was kind of quietly clapping in the background. Across the 10 providers that received awards for this program, you've seen tremendous results. From screenings to education and outreach, all of the opioid use disorder and NAS quality improvement initiatives under this project have absolutely increased the quality of life for mothers and newborns here in Pennsylvania, and the proof is in the results, no doubt about it. So as we move forward with this initiative, I am really excited for its expansion from those solely impacted by opioid use disorder to maternal substance use and substance exposed newborns. So if you're not aware, Pennsylvania has been seeing a really steady increase in stimulant use and polysubstance use for several years now. In fact, treatment admissions where stimulants were the primary substance increased in Pennsylvania from 11% to 16% just over the last 2 years. Also, stimulants are the most common secondary substance for those admitted to substance use treatment. So being able to expand what we're focusing on from just opioid use disorder to a broader category is so very important. As I wrap up today, thank you for allowing me to go a little bit past our time. I'll just again thank you for your dedication to improving care for pregnant and postpartum women, and of course, newborns that are impacted by substance use disorder. At the end of the day, the work that you're doing is providing opportunities for Pennsylvanians to access treatment and to live a healthy life. And that's a life that all Pennsylvanians deserve. We know it's not easy work, but you are all making an impact on a daily basis. So thank you and happy holidays to all of you.